What is the difference between a child's UTI and urosepsis? Imagine a tiny infection starting in a child's urinary system. A urinary tract infection is a bacterial invasion that affects parts like the urethra, bladder, or sometimes the kidneys. It often causes symptoms like fever, pain, or burning when urinating, and maybe a strong smell or cloudiness in the urine. In young children, it can sometimes show up as fussiness, jaundice, or poor feeding. Usually, a doctor will check a urine sample to find bacteria and treat it with antibiotics for about a week or so. Most UTIs in children are mild and can be cured without long-term problems, but if they happen repeatedly, they might cause kidney scarring or other issues. Now, urosepsis is a much more serious situation. It happens when the bacteria from a urinary tract infection break free and enter the bloodstream. This turns the infection into a systemic illness, meaning it affects the whole body. When this occurs, the child might suddenly develop a high fever, chills, rapid heartbeat, and rapid breathing. They might look very sick, with low blood pressure, confusion, or signs that their organs are not working properly. Urosepsis needs urgent medical attention. Doctors will hospitalize the child and give intravenous antibiotics and supportive care to help the body fight the infection. If not treated quickly, urosepsis can lead to shock, organ failure, or even death, which is why early detection and treatment are so important. The main difference lies in where the infection is and how severe it becomes. A urinary tract infection stays within the urinary system, causing localized symptoms. Urosepsis is when the infection spreads into the blood, causing widespread inflammation and risking multiple organs. Diagnosing a UTI involves analyzing urine to find bacteria, and sometimes imaging tests are used to check for urinary tract abnormalities. For urosepsis, blood tests and cultures are necessary to identify bacteria in the blood and assess how the organs are functioning. Treatment for a UTI is usually oral antibiotics, while urosepsis requires hospital care with Roman IV antibiotics and close monitoring. In summary, a child's urinary tract infection is a bacterial infection confined to the urinary system, often manageable with antibiotics. Urosepsis is a dangerous complication where bacteria enter the bloodstream, causing a body-wide emergency. Recognizing the signs early and seeking prompt medical care can prevent serious outcomes. Always consult healthcare professionals if you suspect your child has a urinary infection or if they suddenly become very ill. Remember, each child's situation is unique, and proper medical guidance is essential for safe and effective treatment.